Hey, my name is Emily Corley, and this is my video presentation for PTA 268B. It is on chronic obstructive pulmonary disease, or COPD. So what is COPD? It's a group of diseases that causes airflow blockages and makes breathing difficult. The most common diseases that make this up are emphysema and chronic bronchitis. Chronic inflammatory lung disease that causes obstructed airflow. So as you can see on here, you can see a healthy lung and then a COPD lung. Some symptoms, more common symptoms include the coughing, wheezing, excessive mucus, shortness of breath, not able to take a deep breath. So a lot of people will say like a smoker's cough or something like that, a lot of kind of hacking. Some more severe symptoms that you'll see, unintended weight loss, lack of energy, chest tightness, fever, change in color of the mucus. If it's tinged with red, that could be pretty dangerous. Also, lack of sleep is one. Just overall, just the fatigue is a symptom of COPD as well. All right, so the pathology and disease process. It can be caused by several things. The most common cause of COPD is tobacco smoke. And then you have genetic factors, air pollutants. Some people working inside with different air environments in their working environment can cause COPD. The actual disease, what it does is it affects the lungs' elasticity of the bronchial tubes in the alveoli sacs. So you have the tubes and then the sacs at the end, and that's what it affects. It causes those structures to overexpand and will leave air trapped inside the lungs. Emphysema specifically, the small airways, the alveoli, they'll collapse, causing airflow in the lungs to be impaired. Chronic bronchitis, the bronchial tubes become inflamed and narrowed, and the lungs produce more mucus to kind of help with the inflammation, and that causes even more blockage. With chronic bronchitis, a chronic cough will occur to kind of get the mucus up. So who's affected by COPD? It is noted that 15.7 million Americans suffer from COPD, some form of it. And 50% of the people with low pulmonary function were not aware that they had COPD. So statistics say that that number could be higher. Just if you have less severe symptoms, you might not know that you have COPD. I found a study in 2013. The most affected people were women, people ages of 64 to 75, people unemployed, current or former smokers, because that is the most common cause, and those with asthma. So kind of a pre-existing condition. In 2017, COPD was the third leading cause of death in women in the US. And from different research, it's found that cigarette smoke affects women differently than men. More harshly than men. COPD used to be known as more of a men's disease, but it's now becoming more common and more deadly with women. So the prognosis for COPD is kind of very fast because it's a progressive disease and it will get worse over time if untreated, if medically it's not taken care of. So there are treatments that can help reduce the number of exacerbations that a patient will experience. An exacerbation is just kind of when it flares up. They might experience a deeper cough or something like that. It's treatable with medications, but it can eventually lead to a lung cancer, heart disease, and other more severe conditions if it's left untreated. It's important for these patients to see their doctor regularly and keep up their medicine regimen and their exercise routine, but we'll get to that. Depending on the severity, the 5-year life expectancy can be as high as 70. For more severe cases, the 2-year life expectancy is about 50%, so a lot less. So where physical therapy comes into play, we will do a lot of breathing treatments with these patients. Learning how to better take in air and release air is going to be very important for these patients, because if they don't do it properly, for one, it can cause anxiety if they feel like they can't breathe. So a few different breathing techniques that we as physical therapists or physical therapist assistants can teach them are pursed lip breathing, diaphragmatic breathing, and a huff cough. So pursed lip breathing is just breathing in through the nose and then out slowly through the mouth, like that. And so that just kind of helps slow down breathing, and it also allows for more time for oxygen and CO2 to exchange. So it helps kind of regulate the breathing a little bit better. Diaphragmatic breathing is really to help the diaphragm kind of get more engaged. So the diaphragm comes up, belly comes up, and you push that diaphragm down and really get all of the air out. And this helps engage the diaphragm more and increase the total air volume exchange within the lungs. A huff cough is really going to be helpful for the chronic bronchitis. It's taking a deep inhale and then making a sound whenever they cough, a really hard cough. And it just helps them get that excessive mucus out. Here are some pictures of the breathing techniques. First one is diaphragmatic, then you have the huff cough, and then you have the pursed lipped. So also important are exercises. Keeping these patients conditioned is very, very important. So low impact cardio, stretching, strengthening, ankle pumps, using weights for the arms is really going to be really important to improve sleep, circulation, and just overall improve the symptoms for COPD patients. Some low impact cardio that would be great is like a stationary bike, an exercise bike, possibly swimming, and stretching just to help prepare the body for the workout. And these are some of the things that they'll experience in physical therapy. Medical interventions. COPD, it can be diagnosed with a physical exam, a chest x-ray, and a spirometry breath test that just kind of shows how much air they're taking in and letting out. It can be treated medically with a bronchodilator inhaler to help open up the airway, antibiotic medication in case there's an infection present, and corticosteroids to reduce the inflammation for that chronic bronchitis. If severe enough, surgery can be talked about and can be indicated. A bulectomy is when the bullae are removed to increase lung expansion. These are kind of like the dead tissue at the end. Lung volume reduction is when damaged tissue is removed completely, which reduces the size of the lung. These both kind of reduce the size of the lung, but gets the damaged tissue out. In the most severe form, a lung transplant will be indicated if the patient, everything adds up, but that's at the most severe form. So they'll take the unhealthy lung and replace it with a healthy one. So I chose this topic because, for one, it's interesting. The cardiopulmonary system is pretty interesting to learn about, and it's very dense. The disease is common, and it's important to know the signs and symptoms because I'm sure I'll come across several patients with this diagnosis. So learning how to better treat their symptoms is going to help me be a better PTA. Also, to help the prevention of future patients from this disease, to educate them on how to not get COPD. That will help them in the long run as well. So that's why I chose this topic. And these are my sources. Thank you so much.